Number 1 Online Pharmacy Shop. Buy drugs without prescription. Big choice, cheap prices, fast worldwide delivery. Your doctor might perform a combination of different exams to determine if you have erectile dysfunction (ED). Both physical and psychological tests are used to make a diagnosis. You'll probably be asked about your medical and sexual history as well. In some cases, more extensive exams might be necessary to see if you have other conditions that could be causing your ED symptoms. An accurate diagnosis is important because it helps doctors identify the most effective treatment for you. Physical exam and erectile dysfunction. If you have symptoms of ED, your doctor will probably start with a physical exam to check your overall health. During the exam, your physician might look at your penis and testicles and evaluate your nerve sensation. He may also perform a rectal exam to check your These tests aren't painful, and are helpful since they can provide useful information about your condition. Health history and erectile dysfunction. Because ED is often caused by other medical conditions, your doctor will want to know about your medical history. Tell your physician about any health problems you've had in the past and all the medications you take, both prescribed and over-the-counter. It's also important to let your doctor know if you use recreational or illegal drugs, drink alcohol, or use tobacco products. Personal and sexual history and ED. Information about your personal and sexual history may be useful when making a diagnosis. Your doctor might ask questions, such as: when did you first notice symptoms of ED? What are your main symptoms? How often do you have erections? If you have erections, how firm are they? Do you have erections at night or in the morning? What sexual techniques do you use? Do you notice that your ability to get an erection changes at different times during sex? Are there problems in your current relationship? How has ED affected your current relationship? Do you have problems with sex drive or arousal? It's important to answer these questions openly and honestly, so your doctor can accurately assess your condition in order to recommend effective treatment. Mental health exams. Some mental health conditions are linked to ED. Because of this, your doctor might ask you questions to screen for depression, anxiety, or you may also be asked if you have experienced a lot of recent stress or if any big changes have happened in your life lately. If your doctor thinks there's a psychological cause, he might refer you to a mental health professional. Other diagnostic tests. You might need other tests to check for underlying issues or to further assess your condition. These might include the following. Blood test. This simple test involves taking a sample of your blood to check for health conditions, such as heart disease, kidney disease, low testosterone, diabetes, or others. Urine test. A urine test can screen for diabetes and other health problems that might be causing your ED symptoms. Ultrasound. During an ultrasound, a device is held over the blood vessels that supply blood to the penis. This test can determine if you have blood flow problems. Sometimes, you might also be given an injection into your penis to cause an erection. This allows the ultrasound technician to see how the blood flow and pressure changes in your penis. Nocturnal erection test. With this test, you wear a plastic, ring-like device around your penis at nighttime to test whether you have erections during your sleep. This can tell your doctor if you're physically. Sometimes, this test involves using an electronic monitoring device to record how many erections you have, how firm they are, and how long they'll last. Injection test. A healthcare professional will inject medicine into your penis to cause an erection. Sometimes, the drugs are injected into the urethra. This will let your doctor see how full your penis gets and how long your erection lasts. Bulbocavenosus reflex. This test assesses the nerve sensation in your penis. Your doctor squeezes the head of your penis to see if your anus contracts right away. If it doesn't, a nerve problem may be the culprit. Penile biosthesiometry. It uses electromagnetic vibration to check sensitivity and nerve function. If you have a decreased sensitivity to vibrations, you may have nerve damage. Dynamic infusion cavernosometry. This test is used for men with a venous leak. Fluid is pumped into the penis and measured, so doctors can assess the severity of the leak. Cavernosography. A cavernosography is used with a dynamic infusion cavernosometry. It involves injecting a dye into the penis and then X-raying the penis. This lets doctors see the venous leak. Getting an early diagnosis for erectile dysfunction. The earlier you get a diagnosis of ED, the sooner you can start on treatments that can help your symptoms. Some men are hesitant to tell their doctors about their symptoms of ED because they're embarrassed or afraid. You should know that your doctor is there to help you through this process and provide any support that you might need. Putting off a doctor's visit can delay effective treatment and may be harmful if you have other, underlying conditions. The best plan is to see your doctor early on, so you can get an accurate diagnosis. Number 1. Online pharmacy shop. Buy drugs without prescription. Big choice, cheap prices, fast worldwide delivery.